Good evening, everybody, and welcome to our event. We're so glad to spend this time with you. I'm Kim Burdick. I'm responsible for community banking at Fremont Bank, and we've got a very interesting audience this evening. A good number of our participants are associates of Fremont Bank who are equally concerned about the latest, most reliable information on how to stay healthy in 2020. The other half of our audience are clients, and we're so glad you're with us. We miss you. We've got the best clients in the world, and we're glad to be able to feature tonight's event to share this information. I've got to say, we've got the best experts we could ever possibly bring to you, in that we have this wonderful relationship with Washington Hospital in Fremont. And from Washington Hospital, we have two of their top physicians to share with us tonight to answer the questions that many of you presented in advance. And there'll also be an opportunity to speak to questions that you can submit through your participants' chat screens and speak to those questions as well. First up, let me introduce one of our key presenters, Dr. Halimi, and he grew up in Fremont, so a local success story, now participating as the medical director and section chair of emergency medicine, as well as the current chief of the Department of Medicine at Washington Hospital. So let me turn it over to you, Doctor. Thank you for being with us this evening.
Thank you, Kim. Thank you for the invite, and thank you for everybody for joining us. Can everybody hear me good? Okay, great. Thank you for joining. As Kim mentioned, I did grow up here in Fremont. I'm sorry, I'm in the department, so you guys will hear some overhead announcements when we get codes. In any case, grew up in Fremont, went to Walters Junior High, went to Kennedy High School, did my undergrad at Davis Medical School in LA, and then I don't know if you can see me or not, but I got my Texas A&M stuff on for my residency, so I'm an A&M from Aggie from Texas A&M. Proud to be back in Fremont. I've been here at Washington Hospital since 2004. I've served on many committees along with Dr. Dianne Martin, who's head of our Infectious Disease Department, and I'm really proud to be from Fremont and to give back to the community. And I see Fremont Bank as being one of our essential partners, not only with the hospital, but here in Fremont. With that said, this January, me and my wife, we like to travel with kids. We have 3 kids of our own that we like to travel with. And I booked my flight to where we're going to go to Malaysia and Indonesia and do all this sort of stuff during spring break. We got our tickets, and we had no idea this is gonna happen in late February and March, and of course our trips got canceled just like everybody else's. Nobody knew that this pandemic was going to hit, so really nobody could have predicted it. We had SARS, and we had Ebola, and we had the H1N1 flu, but nothing compared to what we have with COVID-19. Some of the things that make COVID-19 very different than your other viruses that we've dealt with is the fact that there's asymptomatic transmission, and then there's asymptomatic presentation on patients. So I could be sitting here having COVID-19 and not even know it, and not knowing, I unintentionally, of course, pass it on to those who I don't necessarily want to pass it on to, which it makes it different than, say, the flu or any other disease, because you have some symptoms, right? You got a fever, cough, runny nose, so you know to isolate yourself, stay home from school, stay home from work, therefore not pass it to others. The other thing that makes it a little bit more different or difficult to contain is how easily it's passed on from patient to patient. As such, the best thing we can do, and I know everybody's heard this ad nauseum in the media from health experts and all, is just simple hygiene, right? So wearing a mask is probably the best thing we can do, as this is spread through our upper respiratory tract, which is our mouth, our nose. Wearing a mask that's got a good seal. I actually have one of the masks that I use at the hospital. So one that I have goes on like such, and then I always squeeze right here. And for those of us who wear glasses, if your mask has a little piece of metal, if you squeeze it, it doesn't fog up your glasses. And that's good because, air is not getting out, right? So that's a good seal that you have around your mouth. Now, I like those a lot better than the other ones that are out there that you can wear that are kind of loose, or the alligator neck that they talk about. There's actually been studies about the alligator masks, that they're not as effective as the ones that are a little bit more like the ones that I just showed you. So I'm a big advocate of masks. I think masks work great. It's yet to be known how masks are going to help us with the flu season, because the other thing that's going to complicate things here pretty quickly is the flu season, right? So, I would recommend getting the flu, and I think Dr. Martin is going to talk about flu and the vaccine, but I'm certainly going to get the flu vaccine. I'm going to have my kids and my wife get the flu vaccine. And the reason I mentioned that is because whatever I do for my family and my wife, I'd like to offer that to my patients and my loved ones as well. So I recommend you getting the flu vaccine. But, even with the flu vaccine, how is that going to affect us? We really don't know, right? There's so many unknown variables. Kids are not going to school, so they're not going to be exposed to the flu. And people are masking and washing hands. And so we don't know if it's going to be a bad flu strain to start off with. And then if it is a bad flu strain or mild flu strain, how is people's preparedness and wearing masks and washing hands and such, how is that going to affect the flu season? That's really a big unknown that we don't know. Certainly here at the hospital, we're preparing for the worst, right? So the one best thing that happened to Fremont at Washington Hospital is that, 2 years ago, we have great leadership at the hospital, and we had our new building, our new ICU, our new emergency department opened up. We have 40 beds in the ER that are all isolated. So every single bed is isolated to the one next to it, as opposed to our old emergency department where I worked at for, 14 years. There was rooms that were just separated by a curtain, right? So you couldn't isolate. So we really got lucky that when the COVID pandemic hit, we have isolated beds in the emergency department. To further protect our patients in the emergency department at Washington, what we did is we erected tents outside. So now we're separating patients who come into the emergency department who are asymptomatic. They're saying, hey, I have body aches, I was exposed to somebody, or I have a cold, fever, cough. We isolate those patients outside. We don't even let them come inside the emergency department unless they're very sick. If they're very sick, they come straight to a room, doors are closed, signs are put up, so that we do our best to isolate patients from regular patients. There was a regular study that the American Heart Association, I think, did that said, ask patients, if you had a heart attack, are you more scared of having a heart attack, or are you more scared of having COVID-19? And, the answers were surprising because people are scared of coming to the hospital. And so they answered they're more scared of having COVID-19. As a result, we've seen a shift of the type of patients we see in the emergency department. So patients are coming in with chest pain and abdominal pain late in the disease process, right? So they're coming in with completed heart attacks, or heart attacks that we usually caught really early in the past. Now they're not coming into the doctors. And I for one, I'm not a proponent of that. I think if, God forbid, you need to go to the hospital, you need to go to an emergency department, seek medical care, because all the hospitals around Bay Area, and certainly I can speak for Washington Hospital specifically, we're prepared to take care of any patient. And I would highly recommend, sorry, we have no announcement. We have 40 beds, we have tents erected. Please don't delay your care and come into the emergency department, because that's not well advised. Other questions that have come up, as far as our tent testing, what we test in the tent are patients who are symptomatic, meaning they have influenza-like symptoms, or if they have been exposed to anybody. So if you've been exposed to a coworker, if you've been exposed to friend, family members, we'll test those patients. But if you're traveling, so we're not as of right now, we're not a testing site for Alameda County. So if you're traveling, some states, some countries require that you be tested and have a negative COVID test before you travel. Now, it is safe to travel as long as you're wearing your mask and you're washing your hands and you're being vigilant about not touching your hands and nose, and you take some hand sanitizer with you. However, we don't test for travel at this point. Now, certainly, I've personally made exceptions. I had a patient who came in, and his poor father was in the ICU in another country, and he really needed to fly, and he needed a test, so we made an exception and do it. So we are here for our community. We try our best to serve them the best we can. Because one of the questions that is it safe to travel in our testing site? Yes, it is safe to travel, but that means wearing a mask from when you hit the airport, at the ticket counter, on the tarmac, certainly in the plane until you get off, and make sure you carry some hand sanitizer with you, and I think you're going to be safe. As far as dining and going outside, I, for one, me and my kids and my wife, we always had a tradition of going out every Friday night. That was our thing, right? Every Friday night, we go someplace new and go eat. That's just part of our routine. I think one of the toughest parts of COVID-19 that I've seen for my family, and certainly for patients and family members, is being stuck at home, right? This COVID-19 thing is kind of getting old. Everybody wants to go out and just enjoy a meal or go to the park or go do something with their friends and family. And it's hard to stay at home for months at a time and not go outside. So is it safe to go and have a dinner outside? I would say at this point, I would, depending on the transmission of the local community. So, for example, this past 2-3 weeks, thank God, our transmission and our rates of positivity as far as our tests that we're doing going down for Alameda County and certainly for Fremont, and we have to watch what the health experts are saying as far as your level of transmission in your community. So if your community levels are down and you're going to go eat, please make sure you eat outside at a place where it's open air. Make sure that the desk or the table and chairs are wiped down, that you're wearing a mask when the server comes on. And certainly I do that. Yesterday we took my mom and my kids. We went out and had some food outside and dined outside, and we just kind of watched precautions. Now, had I known that it was April or May or June where our transmission was high, I didn't go out those months at all. So really have to kind of pay attention to the news and the level of transmission and level of virus activity. Do I think it's time to open up schools? That's another question that was, we got quite a number of questions regarding going back to work, reopening schools. That's a really tricky one. Nobody has the right answer. And the reason for that is because we've never really been in this type of pandemic in the past. My kids, all three of them, I have 2 high schoolers and a middle schooler, they're at home. They're doing Zoom at home, and I feel like I'm going through school again, doing all the work with them, which is another story by itself. But, I don't know. I don't know how the flu is going to be. I don't know how bad it's going to be. If you send kids back to school, they're going to be exposed. And yeah, kids are resilient and they'll do fine. But what if they bring that virus home to grandma or grandpa or dad or mom or aunt who may have, pre-existing conditions? You're taking that risk, right? And is that really worth it? So we don't know really. We're really living in an unknown environment, unknown times that we don't know what's going on. When I send my kids back to school, I guess I always ask questions. I guess the question to that would be no, I wouldn't send my kids back to school at this point. Now, if the flu is mild, if the rate of transmission is low, if a safe vaccine comes out, sure, January, February, I wouldn't hesitate to send my kids back to school. As of right now, I would not send my kids back to school, so I would not recommend it. Again, I'm not the end-all expert. I'm not Anthony Fauci, thank God, or have his stressful job, but that's just my opinion for what I've seen and my experience with COVID. At this point, we've seen a lot of COVID patients, and I can tell you that it's a pretty tough bug to beat. However, if you're healthy, you stay healthy, you exercise, I think you'll do fine. I think, I don't think there's a whole lot to worry about. Other questions that we had were regarding testing around school testing. Should there be testing around school? But really, the difficult thing, and I don't want to get political at all, the hardest thing that we have today is testing, in that there's not enough test kits in the hospital. Certainly, we have enough to test everybody who gets admitted to the hospital. We make every effort to do that. But to test all of Fremont or all of Bay Area, we don't have enough test kits to do that. We have test kits that'll take time to come back, but not to get it back right away. I'm hoping that changes in the near future, but until that's available, I don't think it's safe enough to send our kids back to school and retest them. So I guess I covered a lot. I tend to speak fast. I apologize. That's my nature, being an emergency room physician. I tend to speak fast. I may have even treated some of these people on the call. You probably know that. Certainly, I'll turn it back over to Kim. And hopefully, since I've covered a lot, we'll have a little bit more time at the end for question and answers. Kim?
Thank you, Dr. Halimi. It's a great perspective. We're all living this personally as well as you are professionally. It's an awful lot to balance. Kids at home, always a little bit scary. Like you say, you're back in high school. And what's the right thing to do for them? What's the right thing for you to do professionally? What would you advise your neighbor to do? And I really appreciate your perspective. I want to also let the audience know that you will be able to chat questions, and so there will be an interactive session at the end of our time. So please take advantage of that at this time. Also in transition, I want to call out Tanya James and Michelle Wynn. They're part of our special events team that helped to create these virtual events for us and our clients. And I want to thank you for a great job giving us this forum. Also, this idea started somewhere, and I want to recognize Helen Liu, who in working with our clients knew that they had lots of questions, and based on our special relationship with Washington Hospital, wouldn't it be great if we could get some of the top-notch physicians to be available for our clients and some of our department managers so that we can do the right thing? We can do the right thing for our clients, for our associates, for our family, and for each other. So thank you, Helen, for this idea. I'm so grateful that we have a chance to spend this time. Our next speaker is also a wonderful expert. Amazing that we have her available to speak directly to us. Dr. Dianne Martin has been with Washington Hospital since 1984. To give you a sense of 1984, that's when the Olympics was in Los Angeles. Okay, Carl Lewis, big deal. Okay, Mary Lou Retton, big deal. She has been with Washington Hospital since 1984, and she is the co-chair of Antimicrobial Stewardship and Infection Control Committee. Sounds like exactly the right person you'd like to have talk to you about what's going on with COVID-19 and what's the most we know today and the best advice we can receive. With that, to you, Dr. Martin.
Okay, so I've been at Washington Hospital since 1984 and started out in private practice and now belong to the Washington Township Medical Foundation, which encompasses a number of primary care and also specialty physicians. So in part of what I do at the hospital is to work with infection control, and we are extremely careful with all the measures that we're doing at Washington Hospital to make sure that we're addressing this virus as well as all other infections. So whether it be Staph aureus that's resistant or some of the other gram-negatives which might come in terms of infections related to surgeries or other processes, that we're dealing with those, and we have the most up-to-date testing and most up-to-date antibiotics available for our treating physicians and available to the patients. We focus dramatically on patient-first ethics. So we want to make sure that everything that's available in the hospital is exactly what we will provide for our own family. So we also have a very dedicated staff, and all the way from administration to environmental services working together as a COVID task force. So this started in late February, early March, when this started to become increasingly aware that there was an issue bigger than what we thought was just some flu from another country. So it was encompassing all of California and people that were traveling, and we saw it in Fremont. We didn't expect to see this, but we did. And our hospital sprung into action dramatically, and we were meeting daily, even weekends and holidays, to try to address the issues as they came up, because a lot of this was a learning experience. I mean, some we knew by the drills that we had done when we thought we might have exposures to Ebola. And obviously we have a lot of experience with seasonal flu and other infections that require isolation. But this was certainly bigger and more encompassing than we had anticipated. And with each step, the hospital took it on and conquered all of it. We worked on ways to educate our staff, ways to get more and more PPE, which is personal protective equipment, whether it's the masks, the shields, the goggles, the headgear that we use for patients that are in ICU, gowns, slippers, on all of the equipment. The other thing we focused on was cleaning all of our equipment. And so we went by different processes looking to see what is the best available for us, for our staff, to protect us as well as the patients. Unfortunately, that meant limiting visitors, which was very hard for all of us. Part of what we do is take care of patients, but also work together with our families. So that was a huge step that we took, not only to protect ourselves, but to protect other patients within the hospital so that other visitors didn't, as Dr. Halimi was saying, unknowingly bring the virus into the hospital. So that's been a policy that's been quite a bit of a challenge. We do have exceptions in terms of pregnant moms with coaches, adolescents who need a parent, and also at end of life. So we do make exceptions for those patients that need support people. The other thing we did was to use the technology. We provided iPads. So we've had iPads in the ICU, iPads on our COVID unit, and throughout the hospital. So families can connect, friends can connect, and get support, because we know how valuable it is for patients to know that their families are supporting them and caring about them and asking about them and praying for them and whatever they need, providing for those kinds of things. So we have problem solved quite a lot, and it's obviously been a huge learning experience for us. We've also searched out various resources that are available that we are looking for. In terms of our personal protective equipment, we had certain vendors that we used routinely, and those vendors became very stretched in terms of providing for lots of other hospitals. So we went to look for other vendors. So we went as far away as New York for some of the stuff that we were getting that provided protection for both patients and staff. The other thing we were doing was working with other facilities. So we network quite a lot with Alameda County Public Health and make sure that our guidelines are in sync with theirs, also with UCSF, but they've been a valuable resource in providing information to us that we then take and incorporate into our policies and procedures. We also, part of what I do is look at antibiotics that are used in the hospital. So one of the things that we were able to access very early on was remdesivir, which was one of the antibiotics. It's an intravenous, not tablet, intravenous antibiotic that was available, gifted, donated from Gilead. And so we were able to access that, and Alameda County helped us obtain a fairly sizable amount of that, and we still are participating with the state and the county to try to get that antibiotic available to our patients as needed. There are fairly strict criteria for this, and part of what the Infection Control Committee and Antimicrobial Stewardship does is to work with the other infectious disease physicians, the intensivists, to make sure we're using the right drug at the right time for the right situation. There are other medications that are out there that we have as a team tried to figure out what's the best way to provide care for our patients. So we try to get a consensus among the intensivists where many of these patients are, as well as the ID group, because we all treat the patients, so we want to make sure that we are treating patients pretty uniformly and we get consensus from experts and amongst ourselves to provide care. So the other thing that we really, really strive for is to make sure that we keep our environment clean. So all of our staff wear masks. That's mandated. And if they're not fitted for a mask, because that's one thing we do is to train and make sure that the staff is fitted appropriately. So this goes from environmental services to administration to the physicians. We all get tested and fitted to make sure that we're using it appropriately. We do have options for people who have smaller faces or wider faces or beards, whatever is needed to make sure that they have appropriate equipment too, so that we're all very well protected. We have gowns that are available, and also we do tend to keep most of the COVID patients on a particular unit in the intensive care unit and a particular unit on the medical side. This unfortunately sort of congregates some of those and makes it a very stressful environment for those taking care of those patients, but we feel that we can support them better and provide the resources that they need by keeping those patients sort of together on one particular floor. Now they are all individual rooms, and they are all what we call negative pressure. So basically, any of the air is being ventilated to the outside so that there's very, very little chance of transmission to our staff or other people in the hospital. So those are some of the things that we have done, and I'm going to show you a couple slide sets. So I'll go back to Kim, and then we can load up the slide set so I can go over a little bit more information in more detail. So these are the safety measures that we are doing in a healthcare setting. We are pre-screening in advance of appointments. So anybody coming into the hospital that needs like an x-ray appointment or a joint replacement appointment or coming into our offices, they get screened. We check temperature and ask them a series of questions, looking to see if they have cough, fever, sore throat, muscle aches, joint pains, rashes, nausea, vomiting. So this occurs at any point of entry into the hospital, whether it's coming in for the lab or coming in for x-ray, coming into the wound care clinic, patients who are being admitted for either urgent or elective surgeries. We also do mandatory masking for all of the patients as well as the staff. We also test for COVID-19 for patients who are coming into the hospital being admitted, whether it's elective or urgent surgery. Patients that are being seen in like x-ray or lab, those are not tested specifically for COVID-19. But any of the patients that are being admitted or even for outpatient surgery, those are being tested for COVID-19. Next slide. So we maintain isolation for any time we're in any time of group. We are, if we're not Zooming, we are keeping at least 6 feet apart. We have designed special break rooms for the staff so that they have areas so they can take time out, but these are widely spaced so they can take a break and the break is safe. And that we also have isolation rooms dedicated for suspect patients, because sometimes patients come in with symptoms, and before we get the testing reported, we want to make sure that they are treated the same as if they had COVID until we find out if they do or they don't. And obviously confirmed COVID-19 patients always have isolation. So anytime patients come in with respiratory symptoms, whether they're coming into the ER or even patients who are being screened or our staff who are being screened, if they have respiratory symptoms, they are redirected to another part of the hospital to be further checked out. Next slide. So we also do rigorous cleaning. We're cleaning from top to bottom. We're also, like I said, maintaining personal protective equipment and ensuring that it's used appropriately. So in part of what we've done is when we sometimes change vendors, we get a slightly different product. So what we're doing is educating all of the staff throughout the hospital to make sure that they understand how this, even a slight color change. So we went from a blue mask to an orange colored mask. So we educated everybody specifically so they knew that these were masks that were safe and how to use them and make sure that they had appropriate access to it. We have hand sanitizers throughout the hospital. Every room has at least one, sometimes two hand sanitizers and also tissue box. So you can see from the gentleman wearing the yellow gowns, we wear that for all of our patients. What we did in trying to conserve resources, we have what we call reusable gowns. So they're of a sort of a silky fabric that's been treated, and those can be washed up to 25 times, at which time then they're considered no longer or they're more permeable, so we actually discard them. But we're also trying to conserve resources as well by using reusable where we can. Next slide. So we want to make sure that when people are in the healthcare setting, even if you're in the office or in the lab, there's physical distancing. So what we do is mark some of the chairs as, not available. We're very careful restricting people coming into the clinics. For our office, we sometimes will alternate a video visit with an in-person visit so that there's definitely spacing. The patients, we know that they're coming in, so they're screened at the door and they go directly to the exam room without going through any of the other areas. We offer telehealth. So We can do video visits or telephone visits. We do virtual check-ins, remote monitoring. All of those are available throughout the WTMF clinics as well as other areas in the hospital. Next slide. There we go. So in terms of public settings, just like Dr. Halimi was talking about, we encourage you to do social distancing. So whether you're in an out-of-doors dining or you're in the shopping mall or getting gas in your car, try to do social distancing. We encourage everyone to wear a cloth mask all the time. If you have access to the ones that we use, that's fine, but a cloth mask, I think, for community is quite worthwhile. They should be washed, so if you are sneezing, coughing, or talking a lot to where the mask gets damp, then we worry that that's not going to be as protective. So you might want to carry a spare in your pocket or purse or backpack, and then wash them frequently. Also avoid touching anything. So, and when you do touch things, try not to touch your face, your eyes, nose, or anything like that. So, next slide. We encourage people to do practice hand hygiene. A lot of times we've been giving out the small hand sanitizers, so we encourage people to use those liberally. Washing your hands is also very good. And again, don't touch eyes, nose, or mouth. And if you do need to cough or sneeze, we encourage you to cough like into your elbow if you're not wearing the mask. And then if you are wearing the mask and it gets saturated, it should be changed out, whether you're using the disposable masks like we use or the reusable cloth ones, either way. Next slide. So what can you do at home? As boring it is, stay home. Just stay home. I mean, it's terrible. This will end. I don't know when, but it will end. And staying home is the safest, best thing you can do. If you're home with loved ones, they're basically in your social bubble. Transmission between family members, as long as they're not going out, usually is very, very safe. We still encourage people to clean everything. Clean anything that's coming into your home, disinfect anything that's frequently touched, especially if somebody's coughing. And you may have allergies. I mean, people cough and sneeze with that. It's not COVID, but still maintaining sanitation is very helpful. Next slide. So what to do when you go out. So people who are exercising outdoors, basically if they can space themselves out from someone else, even if you have a running partner or a biking partner or jogging partner, try to give yourself a little space between, especially if you're running without a mask, which is some people do. You're more likely to expel more saliva and more forcefully. So we encourage people to visit parks that are closer to your home, and again, try to space out from people that are walking or picnicking. Try to avoid peak hours, so early morning or later in the afternoon might be better. And again, physical distancing. So if somebody's coming along the jogging path, either stop if you can and space yourself off to the side, or if you're biking, maybe you sort of take a slightly different route so that you're spaced out appropriately. Next slide. So this is a little bit about the influenza as well as the COVID-19. It's probably a little bit too early to tell what our flu season is going to be like, but when we look at the Southern Hemisphere, which usually gets influenza before we do, they've seen a dramatic flattening of the curve for the influenza. So we're optimistic, hopeful that our curve will be flattened as well. But since we don't know, we strongly encourage, just like Dr. Halimi said, get your flu shot now. Usually in California, we don't get influenza until probably late December or January. So we were originally encouraging people to wait until October. But at this point, we're encouraging people to get flu shots as soon as you can available. We've been giving them out through our office and through the hospital since the beginning of September. Both COVID-19 and influenza have fairly similar symptoms between cough, congestion, fever, body aches, sore throat, shortness of breath. All of those are very, very similar symptoms. So when somebody presents to the ER or to the urgent care, we do have testing available that's fairly rapid turnaround time that can distinguish between influenza A, influenza B, the other virus that we commonly see, respiratory syncytial virus, as well as the COVID-19 virus. So those are available in the urgent care. Most of us in the office encourage people, if you're sick, not to come into the office if you have respiratory symptoms unless it's really urgent. If that's mandatory that we have to see somebody, they're seen at the end of the day, and we do what we call a terminal cleaning of that room. So it's basically ceiling to floor and everything in it gets cleaned thoroughly multiple times. So we're trying to get people redirected if they call in or we think they're coming in and they have symptoms, we redirect them to the urgent care or to the emergency room. Some people may have nausea, vomiting, diarrhea, although this is a little more common in children. So that's another thing to kind of look for in somebody who presents with an illness, and to look for it in yourself. Because if you think you have these symptoms, feel free to call your doctor's office, but be aware that you may get redirected to either urgent care or to the emergency room. Next slide. So both of these are spread by droplets. Like Dr. Halimi was talking about, if you cough or sneeze, this expels droplets. Some of you may have seen the pictures where the cough is backlit and you can see the spray against the light. I mean, it's tiny, tiny particles that you traditionally can't see contain billions of virus. So anything where you touch something that's had contact with that nasal secretions, saliva, respiratory secretions, that carries a lot of virus. So touching any of that and then touching your face, your eyes, your nose, mouth transmits the virus. Both of these can be slid before people get symptoms. So I know Dr. Halimi talked about a little bit about being asymptomatic. So both the respiratory syncytial virus, the influenza virus, and the COVID virus can be transmitted by a person who is not aware that they have symptoms, which is why we're truly hoping that some company is going to come up with enough of testing agents to where we can be tested much more frequently. Right now, we're very careful about testing all the people coming into the hospital. We judiciously use which tests with a fast, rapid turnaround time versus somebody who's preparing for surgery. We see them a couple days ahead, test them for a test that's sent to a reference lab that comes back in about 2 days. Those people are told strictly to self-isolate, not to go anywhere once you've been tested and you're preparing for surgery or some other procedure. So complications that are very similar between both the COVID virus and the influenza virus are bacterial infections that can cause pneumonia, sepsis, which is bloodstream infection, which causes devastating illnesses in a person, respiratory failure, especially the COVID, they get extremely short of breath. They get neuromuscular complications where they get generalized body aches and weakness. This is common in both of these viruses. Heart complications, more common the COVID than influenza, but seen in both. Lung complications also seen in both, and hospitalization in both, and unfortunately, mortality. We have seen patients at Washington Hospital who have died of COVID. Next slide. So the Centers for Disease Control recommends annual flu vaccine for everybody 6 months and older. So there's no age limit to getting your vaccine. We do strongly recommend that essential workers get it. Healthcare personnel in our hospital alone are offered the influenza vaccine. It's offered for free. We are very strict about requiring that they get it. And if they have a decline rate, then they will continue using masks. But our decline rate is usually less than 5% per year, which is the highest in Alameda County. So we are very proactive in making sure that all of our staff, whether they're environmental services, lab staff, hospital employees, physicians, administration, everybody gets offered and strongly encouraged to get the influenza vaccine. We also encourage people in nursing homes, long-term care facilities, pharmacy staff, and anybody in a critical infrastructure workforce to make sure that they get the influenza vaccine. If we ever get a COVID vaccine, same people will be targeted. So people that are increased risk for severe illness from COVID-19, obviously patients who are immunocompromised, adults who are 65 years and older, residents of skilled nursing facilities because of their debilitated state, congregate living, whether it's a psychiatric facility or a respite facility or a residential care facility, and also patients who are immunocompromised, whether they have influenza, have COPD, emphysema, or diabetes, or rheumatoid arthritis. There are also certain racial and ethnic minority groups that are disproportionately affected. So one of the things that we've done with remdesivir specifically is to make sure that we are making this available to anybody that comes into our hospital system, whether we think they can pay for something or not. This stuff is extremely expensive, but in the long term worth it. So we make sure that this is available without respect to income, racial minorities, ethnic minorities, or any other groups. So we don't discriminate on that at all. So persons at high risk of influenza complications are very similar. Infants and young children, pregnant women, adults 65 years and older, and other persons with underlying medical conditions. Obviously, there are people that should not get the influenza vaccine, and those who have life-threatening allergic reactions to the flu vaccine, and those who have had what they call Guillain-Barré, which is a neuromuscular disorder secondary to influenza, should not get the vaccine. There are vaccines that are available that don't have the egg in it, which is why a lot of people think, well, I have an egg allergy, therefore I shouldn't have the influenza vaccine. There are what we call recombinant vaccines, which do not have the egg protein in it. They're made in a different form or fashion. Those obviously are more expensive, but obviously available. We have those available here. All the pharmacies have those available as well. There was a vaccine, or still is, the Flu-Mist, which is an intranasal, which is also does not have the egg allergy, but CDC does not feel that that is as effective. So that one we traditionally don't offer or recommend, but obviously it would be an option for someone who has egg allergies and can't access one of the other vaccines. Next slide. So this is just various resources that you have available to you. Washington Hospital has their website specifically. Alameda Public Health has a website specifically for COVID-19, and obviously CDC and NIH also have COVID websites available. Even the San Francisco Chronicle has websites available. Okay, I think that's my last slide. Oh, yeah. Okay, this is take-home message. If you don't do anything tonight, take this message home. Wear a mask, wash your hands, watch your distance. We call it the 4 W's, or the 3 W's.
Well, thank you very much, Dr. Martin. That was very, very comprehensive. I appreciate the PowerPoint presentation to give us kind of a visual reference as well. What we want to do is we have about 14 minutes left. And for all of our participants, you have an opportunity to go to the chat function in your upper right, the ... open up chat, and you can text questions into our physicians. And I believe Michelle will help to facilitate featuring different questions so that they can speak directly to what's on your mind or concerns at this time. So take a moment, and if there's a clarifying question, by all means, chat it up and we'll see if we have an opportunity to speak to it.
Kim, I'll start with one that there's nothing in there yet that I noticed on the list. For either Dr. Halimi or Dr. Martin, and one of the questions was about going to see your dentist, and is that something you advise, or is there any reason you shouldn't go?
I can take that, and Dan, if you want to add anything. So I would say yes, it is safe to go see a dentist, depending on your dentist office. I know my younger sister is a dental hygienist, and they have PPE just like anybody else in their office. They wear an N95 mask, they wear a shield, they wear PPEs, and they wipe down before and after each patient that they see. So it really depends on your dentist and their level of preparation. If you have, a dental emergency or dental work that needs to be done, there's really no reason for you to delay that if your dentist is prepared to do so. And dentists, to my opinion, are professionals, and they look over their patients as they would anybody else. And I've gone to the dentist during this pandemic, and my sister, like I said, was a dental hygienist. My other sister is a dental office manager. They see patients, and I would say if your dentist is prepared, there's no reason why you shouldn't. Are you at more risk? Again, it depends on your medical conditions and how prepared they are. But in general, I would say it is safe, and I wouldn't delay getting any kind of dental work done. Diane, do you want to add anything to that?
I know they go by the American Dental Society, who makes recommendations, and I also went to the dentist in June, and I was very impressed how they sort of checked you at the front office as you're coming in, screened you just like we do. They all had masks and shields just like we do. They don't use as many of the drills and things which would aerosolize stuff, and the suction apparatus was quite different too. But I mean, I felt safe. And again, I think it's a comfort level that the individual has. If it's just a routine cleaning and you want to postpone it, I would check with your dentist and see what their recommendations are. But again, like Dr. Halimi said, if it's a dental emergency, you really should take care of yourself. And most of the dentists, as far as I know, are extremely careful. I mean, they want to protect themselves and their families too. I mean, they have, a lot of concerns, not just for their patients, but for themselves.
Thank you, Dr. Martin. Looks like we don't have any other questions. I'm going to go back to the list again on things I see that I think didn't get covered. So correct me if I'm wrong. Is contact tracing really going on with quarantine control? Is that one that we can?
Go ahead, Diane.
Well, we do some contact tracing within the hospital as patients are coming in that are diagnosed with COVID, making sure that information goes back to the county. And then also we make phone calls to their family to make sure that the family also goes and gets tested. So we do try to do contact tracing somewhat, but it's mostly in conjunction with Alameda County Public Health.
I would concur with that. When we test in the emergency department, every single patient that has a positive test, we call that patient and tell them, hey, you're positive. Please make sure you isolate, give them precautions, tell them where to follow up, give them precautions on when to seek medical attention. And then we also call our infectious prevention department, let them know of positive tests, and then they turn that information over to the Alameda County. And then they do whatever kind of contact tracing that needs to be done. Certainly in the hospital, when we have a positive patient, there's a sheet that's placed on, or even patients who are under interest or being investigated, we put a sheet on the door and we write down every person that goes in and out of that room, just in case that person becomes positive or has a complication that we need to go back and see who was in the room. As well as we do contact tracing in the chart with electronic medical records. Anybody that is gone into the room or out is kind of traced to see if anything needs to be done. So we're pretty careful at the hospital level, and certainly we let patients know right away if they're positive and what to do in such cases.
Okay, I did get a couple of questions. First one is for, would you give your mother the first COVID vaccine?
Diane, you want to take that one?
I think that's it's a really good question, but I'm not sure we have the answer. I mean, I'd like to see the data on some of that. I know some of the companies are coming out with some vaccine candidates, and I haven't seen what the stats are on the testing. If we came out with one that was safe and I thought it was reasonable, I would recommend it for myself, my staff, and my family.
Yeah, I would echo those sentiments. It really has to be at the vaccine when it comes out. Look at the data, look at the trial to see how safe is it, how many patients did they try it on, or not. And at that point, you can make a really an educated guess of what to do. Without looking at that, it's kind of hard to predict when that's going to come out. Are they going to try to rush it because of the election, or are they just going to do their due diligence and get the right data and get a safe vaccine? If, for example, tomorrow morning, I'm probably going to go get the flu vaccine because I know it's safe, the data is safe, they've worked on it for years, and it's safe. So I have no issue. I'm going to get my wife and kids and my mom and everybody else to get it as well. But as far as the COVID vaccine, really what Dr. Martin said, let's see what the data shows, let's see how safe it is, how many patients that they tested on, what the side effects were, and then we can make an educated recommendation. And I would certainly ask your primary care provider for recommendations in that department.
Okay. Thank you both. Here's another one, and I'm going to read it because it's right in front of me here. How long will this go on, meaning the pandemic? given that we don't have a vaccine yet and we don't know how effective a vaccine will be, and we know how many people will refuse a vaccine. So we understand you can't predict how long we will need to be in social distancing using PPE, but what is your general feeling about it, with how long this will go on?
I think that, Diane, if you don't mind, that really depends on a couple of things. One is the flu season, our flu vaccine, and then really the vaccination we just talked about as far as COVID goes. If we get a good, effective vaccine, number one, number two, enough people get the vaccine, right? So if we come out with a vaccine that's really good and only 20% of the population gets it, we're still in the same boat, right? So one has to be a good vaccine. Two, enough people have to get it, and then we'll know. If those two things happen, my guess is by probably next summer, we're going to be in a much better shape. But without those two things, it's hard for me to predict how long it's going to last.
Yeah, I think we would love to have that answer, and at this point don't know. But I still would say, keep your guard up, even when we're going through the process, because to manufacture, if we got a really safe one, it was really effective, to manufacture that many doses of a vaccine. And there are some trials which are indicating it might need a booster. In other words, might need 2 shots to get full protection. So you're looking at vaccinating enormous numbers of people. I mean, just the companies that produce vaccines, they're going to high gear just to produce the little tiny bottles that the vaccine goes into. So, I mean, there's so much work that goes behind this that they are right now tackling and working on, so that when that vaccine, I'm praying when, will be available, they're going to be set to go, because they're trying to get it shipped out, trying to get it resourced, trying to get allocation. Does it go primarily to the nursing homes first, the hospitals first, the schools first? Try to decide all of those things. It's going to need a lot of level-headed people helping the physicians try to make the best project or procedures available to all of us.
Great, thank you. One question is, in Alameda now, Alameda County is now a red tier and opening up. How do you feel about kids' activities in sports, such as baseball, and the comfort of allowing these kids to play?
Well, I think, my son does cross country at Moreau, and, he's chomping at the bit to go back and start running. It'd be nice if schools could test like the professional athletes can, like, the NFL and the NBA and MLB. If they could test in that way and make certain that, kids are safe when they're playing, they're interacting. I know the levels are low, but then again, the testing level is not there where I feel safe enough to send my kid to playing sports. I think we're hopefully, again, going to get there. But to me, at this point, like Dr. Martin said, I think very eloquently is, just not safe. I would still kind of segregate and be very cautious at this point, because, kids, yes, they're resilient. The rate of infection and recovery is very good. However, the virus is still out there, and then they can go out there and play. It only takes that one player to infect the rest of the team, and that they can come home with that. So my personal opinion is that we're not there yet.
Got it. Thank you.
I mean, one of the things they've talked about is, like, if there's someone within your social bubble. So if you have like a neighbor person that you're interacting with ordinarily, then sports or activities between those smaller bubbles would probably be acceptable. And I know they're looking at trying to do bubbles for sports, but they're small. I mean, they're talking 6 to 8 kids. So I think some of the people are looking at that. I've not seen any of the data on it, but I know those are ideas that are floating out there. The other thing about being in the red, it's definitely better than being the purple, but we just got into the red. So generally we need to stay in the red, or at least maintain that level of lower number of virus and lower number of cases, to make sure that going forward is going to be safe and protective.
Thank you very much. We still have a couple more, so I just want to acknowledge it's 6:27, so maybe we'll run 5 minutes over, because I would love to get to some of these questions. This question is it safe to sit in a conference room without a mask if you sit 10 feet apart?
Diane? Well, I would say is if that person sitting next to you, 10 feet apart, is not coughing and sneezing towards you, and it's maybe safe, but it all depends on how careful they are and what you're doing. I guess to me, maybe it's just because I wear this thing so often. You know, I think I dream with my mask on nowadays. I think I don't see the utility of sitting somebody 10 feet apart when you can just have this on and sit there. To me, I know it's annoying to put that on there. You can't talk in here as well, but to me, this is a little inconvenience compared to getting it and transmitting to somebody else. So, again, it's just really personal preference. I'm sure you get 10 people in the room, they'll give you 10 different answers, but I'd rather always be safe than sorry.
Yeah, I would agree with that. The other thing is we have so much technology available. You can Zoom or FaceTime almost anybody. I mean, it's nice to be able to see somebody and talk to them face to face or person to person, but right now I think it's just much safer both for us, for your family, if you were to bring something home, and for that person. I mean, they don't know that you don't have it and you don't know that they don't have it. So, just use the technology. I mean, chat on the phone or FaceTime or Zoom. I mean, it's just getting so much easier.
Thank you both. Question, this person heard on the news a couple of days ago that COVID has mutated into a different strain. So maybe it's strand. Can you tell us anything about that? Is there any knowledge on that?
There's a lot of theories about the mutations because there is a firm in San Francisco that looks specifically at the mutations of the virus. And if you look at the virus that we have in California, it's uniquely different than the virus that's in New York. We think that ours came mostly from the Pacific Rim countries, whereas New York came mostly from the European countries. And if you look at how it's affected people and what the rate of infection is, those are fairly different viruses. And I think that there is potential for mutation, especially as more and more people get this virus. I think we're going to see that. I don't think I've seen a lot of statistics on if it's a huge mutation in terms of being resistant to like remdesivir or more aggressive in terms of pulmonary or cardiac. I haven't seen any of that lately. But we already know that there's two different, very, very different strains between East and West Coast for U.S. alone.
Thank you for that. Here's a question about when I'm flying. Do you have an opinion about face shield use or possibly some safety glasses on an airplane? I know Dr. Halimi had mentioned, I think earlier, just about the mask, but do you guys think more is better?
I would say yes.
Okay.
Actually,
great.
less is better if you stay home.
There you go. Just stay home. Don't go. Got it. How about wiping things down? I think one of you mentioned anything you bring in the house, whether it's takeout food or whatever, should that all continue to be wiped down? And what about fresh vegetables?
I think most of us would recommend wiping some down. I mean, I think it's not as much of a virus or not as much infectivity as if you're standing next to somebody who's coughing or sneezing on you directly into your face. Things like the mail and stuff, I wouldn't do that. But things that you're packaged things that you're bringing in from the grocery store because you don't know who's handled them, wouldn't be a bad idea just to wipe them down. Now, do you have to bleach wipe them down? No, probably just, mild soap and water wipe down. But I have people who want to leave their mail in the garage for 2 days before they bring it in. That might be overboard.
Agree.
Thank you. Thank you both. Is it, at this point, do you think it's safe to mix the COVID vaccine with the flu vaccine?
I don't know that you want to. I don't think they're going to do that. I mean, to try to put we haven't done that for any other vaccine where there's two, well, I guess mumps, rubella, there is combination, but I don't see, because the influenza vaccine is made way far in advance. I mean, this vaccine that we have now started out in March. So coming up, maybe future it might, but I sincerely doubt that they would combine it. I doubt that. I mean,
and then if the question is whether you should get one and it's okay to get the other, if you have a good, effective COVID vaccine and you already got the flu vaccine, then there shouldn't be a problem. But again, we have to kind of wait and see what comes out, how good it is. And if you've already had the flu vaccine and a good one comes out for COVID, absolutely, I would be okay.
Great. One last question. What symptoms have you seen in COVID-19 patients locally?
Well, in the emergency department, I can tell you that we've seen everything from joint aches to fever to fatigue to loss of smell to shortness of breath to GI symptoms to completely asymptomatic. They come in because they're exposed to a family member a week ago. They have no symptoms. They know that there's somebody told them, hey, so-and-so was exposed. They're coming, they get tested, they're positive. So we've actually seen the whole array of symptomatology in the Tri-City area. And I know in the hospital, we admit patients who are sicker, but I've personally seen everything in the emergency department. Dianne, do you want to comment?
It seems to kind of come in waves where we do see people who are intensely ill and those are less ill. I had a patient from one of the nursing homes. She's like 92 years old. She had such a mild case. If we hadn't tested her, we would never have known that she had it. She wasn't coughing much. She was a little bit short of breath. We thought she had a cold. So this just shows you how you might anticipate somebody who's that old is going to be really, really sick and obviously spread virus. So that's why I think when Dr. Halimi was saying, I think one of the most important things besides vaccine is getting accurate testing with fast turnaround that we can do multiple times. I mean, I'd like to see even our staff being tested like once a week, and we just don't have the technology for that yet. I'm positive it's coming, but it's just not there yet.
Great, thank you both. One last question: any comment about using UV wand to kill viruses? To kill the virus.
I don't have any information on that one. Sorry.
Yeah, I don't either, and I don't. Again, common things being common. Wash your hands, your face, wipe things down. I think those are most effective things that we can do.
Okay. All
so
right, Kim.
We super appreciate your organizing this and letting us get the message out to the public, because we feel like if they hear it from us that can explain things, then you're going to be less trying to sort out fact from fiction. And I think it's extremely beneficial what you're doing, trying to reach out to the community, because this is the message we want to bring out to them.
Thank you, Dr. Halimi. Thank you, Dr. Martin. So with that, thank you for joining us. Have a safe and enjoyable evening, and we are adjourned.